Good afternoon, everyone. Welcome to today's Rural Community Sector Telebriefing. We'll get started in just a minute while we let folks finish joining us online. Thank you. All right, let's get started. Welcome, everyone. I'm Liz Wellbrock, and I manage the Rural Community Sector for the County of San Diego's Department of Strategy and Community Engagement. First, a big welcome to those joining us for the first time, and those who are returning. Thank you for staying engaged with us. Your input and partnership have made all of this work possible. So for the past 3.5 years, our team has worked closely with the Rural Communities Work Group and with your feedback to share timely, practical information that helps keep our rural communities healthy and safe. So today, we're kicking off the new year with an important topic, flood warning systems in San Diego County. And then after that, we'll hear from our Rural Community Resource Panel. So our goal today is simple. We want to make sure you have the tools and resources to stay safe and resilient before, during, and after flooding events. Our Office of Emergency Services calls days like this blue sky days. Those calmer, sunny days when we're not typically responding to a large-scale disaster, and we have time to learn and prepare ourselves. So thank you for being proactive and joining us on this beautiful blue sky day. We've got a great lineup of local experts who will share insights on emergency preparedness, early warning systems, and community resources, all tailored for the unique needs of rural areas across San Diego County. So today, our telebriefing will start with announcements from Livewell San Diego and our partners. We'll have a presentation, Q&A, followed by a panel discussion. And then we'll close today's meeting with Q&A with the panelists. And we have so many experts in the field today, so please take advantage of this real-time opportunity to get your questions answered. Now, if you haven't already done so, please let us know who's joining this afternoon by greeting one another and entering your name and organization in the chat box. And for those of you new to this telebriefing, again, welcome. We're grateful to have you with us. And a few reminders before we begin. This meeting is being recorded and your lines are muted. Please remember to submit your questions in the Q&A box right here at the bottom center of your screen. And if due to time constraints today, we don't get to your questions, please reach out to our team. You can follow up with us via email at the email listed here and also in the chat. And if you'd like to receive the recording of today's telebriefing and share it with your networks, please sign up for our email updates by clicking on the link shared in the chat. We'll start with a few announcements from the Livewell San Diego team. Let's continue these types of conversations from our telebriefings on our virtual connection hub. It's an online platform, and we have 3 great tools where you can connect with us and one another. We're highlighting one today, which is a Map Your Organization feature. You can access the link in the chat, go to View Map, and then click the new pin button on the little blue one right there on the screen. And there you can add your address, your name, your organization, a picture, and even a comment. And we'll also drop the link and the QR code. It also has a feature where you can introduce yourselves and connect on the Virtual Connection Hub. Next, we have the Virtual Learning Series. It's on the same place. It's a self-paced learning and engagement opportunity. You can listen to important public health topics created by our Livewell San Diego recognized partners through a series of pre-recorded podcasts. And so February is Love Your Heart Month, and our monthly topic will focus on heart health. So please scan the QR code right here on the screen, and you can access the learning series. Now I will pass it to Teresa Greenhall, my co-lead for the Rural Work Group, and she will walk us through some community announcements. Teresa?
Thank you, Liz. Excuse me. We have a few announcements and events happening in our community. San Diego County is launching a solar equity program pilot to help income qualified homeowners reduce energy costs by providing financial assistance for solar installation. For more information or questions, visit sdsolarequity.org or email sdsolarequity@energycenter.org. And I think you guys will put those in the chat box, right? So they can access those. Perfect. Our San Diego County Fire CERT program is hosting 9 events from this point in January through the end of March. And we've got a packed calendar. So if you would like to get on that email list, find out what we've got going on, please contact me via email. That will be in the chat box if you need it. And I'd be happy to send you our calendar. We are partnering again with AARP San Diego for a series, and that's what's on the screen here, a series of trainings. Again, the link to register will be on the calendar. If you send a request to me, I'll get you that link. So Leslie got my contact information, and then I hand it back over to you, Liz.
Thanks, Teresa. Lots of exciting opportunities to share. Thank you. Next, I'd like to introduce Tyler Rodenbaugh. He is a senior meteorologist with the County of San Diego's Department of Public Works Flood Control. Tyler has a passion for understanding weather and atmospheric science. Outside of work, he enjoys hiking scenic trails and exploring new destinations through travel. So take it away, Tyler.
All right, thank you, Liz. Hi, everybody. It's nice to speak with you all today. And today I'm going to talk about the county's alert flood warning system and some of its applications that could be useful for your purposes. So The acronym ALERT stands for Automatic Local Evaluation in Real Time, and the concept for ALERT was developed by the National Weather Service in the 1970s. So San Diego County opted to develop its own alert system in 1982. And during that time, we started with around 25 stations. And today we have over 100 stations in our network reporting various meteorological and hydrological parameters to help monitor rainfall and stream levels across the county. Right? So here's an example of what one rain gauge looks like in our flood warning system. This is called a tipping bucket rain gauge. And as you can see in the center of the image, the rain falls into the bucket. And then one of the funnels then collects that rainfall. And as soon as it, uh, I'm sorry, the rain falls into the funnel. And then once one of the bucket collects that rainfall, it then tips and records that measurement. And then below this tipping bucket, we have electronics that then collect that information and then an antenna to transmit that information over longer distances. Additionally, these are all self-sufficient and they are powered by solar panels and batteries. Right? So in addition to that, we have about 32 string gauges within our network. Some of these are maintained by our group and others are maintained by the United States Geological Survey. And then we also have 12 weather stations within our network reporting various meteorological parameters like wind speed, humidity, temperature, etc. Let's see. Can we go back one slide? Sorry, I think. Oh, okay. Um, all right. Is there a slide with a map? I do apologize. Okay. We can move forward one. All right. So within our network, we do have two subsystems. The first subsystem that we have is called the Tijuana River flood warning system. And this system covers the Tijuana River watershed. And this system was developed after a series of devastating flood events between the 1970s and 1990s. And the county worked with our Mexican counterpart to develop a binational flood warning system. And so the infrastructure for the system was established in the early 2000s, and we have gauges on the Mexican side, but also the U.S. side, the border, helping to report information across this watershed. And so this information is then sent to our servers here at the County of San Diego, and then this information can then be transmitted to emergency officials on the Mexican side of the border as well. So the second subsystem that we have is called the Pumacha flood warning system. And this system was developed after the devastating 2007 Pumacha fires. And these fires burned on and above reservations in the San Luis River watershed. And so because of that, the burned area emergency response team identified urgent flood risk because of the burned landscape. And so their recommendation was to develop an early warning system for this area. And so um, after that recommendation, the Bureau of Indian Affairs then initiated the design implementation of this system. And this system has been integrated into the county system. And so this system then relays or collects information from some of the reservations in the San Luis River watershed and sends it to our data servers here at the county and then relays that information back to emergency officials should there be any warnings or notifications generated from the recorded information. All right, next slide. Okay, so how does our system work? So our system works by first, our remote gauges and sensors out in the field sample rainfall or water levels as they happen. And then After that, when a value changes, then our stations key up the radios and then sends a short data message. Then nearby radio repeaters then listen to this message and then relay it to our county receiver so it can reach the county's central operations center. And if you're not familiar with a radio repeater, it's a device that retransmits radio signal over longer distances. And since we have complex topography in San Diego County, this helps us really collect information over a large area. So then once this retransmitted signal then comes to what is called our radio receiver, this information is then decoded into three things. One is the station ID, the time, and then the value that was reported. And then from there, we have a software that looks at the incoming data and then screens out the obvious bad or duplicate values and then updates our maps and charts in real time so the staff and end users can see what's going on across our network. And so if any of those values reach a level we programmed, for example, over a low water crossing, then our system will send an alert. And on the right hand side of the screen, you can see how that looks on a phone. The text goes to county staff, emergency officials, and our county road crews so that they can close roadways, check a site, or reopen the roadway as soon as the water goes down. But as I'll go into detail a little bit later on, there's notifications beyond just water level that we have for our system as well. Okay, so the rainfall alerts in our system start with a simple baseline. We use the 2-year, 1-hour rainfall from NOAA Atlas 14. And NOAA Atlas 14 is a document that provides precipitation frequency estimates across the United States. And so from there, a 2-year, 1-hour recurrence interval is roughly corresponds to about a half inch of rain per hour. And at this point, that's when we start to see impacts from nuisance flooding. So such as water ponding on streets, areas with slow drainage, or trouble spots that are known by our road crews to flood. And so we set our first alerts at these levels. And so a 2-year recurrence interval means that amount of rain has about a 40% chance of occurring in a given year. So it's not a promise that it happens every 2 years, but it's a probability that it'll happen in a given year. And so from there, our system is built to alert at higher rainfall frequencies, all the way up to the very rare events such as 100-year or 1,000-year estimates. And so these higher levels then help alert everyone and keeping them situationally aware of how extreme the current rainfall is, which can then translate into more significant flooding if it keeps on going, or if the basin in which the rain is falling is already wet. Okay, so then we monitor the rainfall side, but then on the stream side, we're also watching water levels. And so for our stream gauge alerts, we set alerts at the stage where nearby low water crossings, road dips, or culverts are known to start taking in water. And so these stages come from past events, input from our road crews, and also site surveys. So when a gauge reaches this stage, our system then sends out an alert to our county road crews and operational staff that gives them time to stage barricades, get to the crossings, and shut them down before the water gets too high. And then after the water recedes and drops below the alert stage, then a notification will go out to let them know when to return, remove debris, or reopen the road safely. So the graph in the upper right is an example of how the system plots this. The blue line shows the measured stream level over time. The horizontal colored lines are the alert stages we set for this particular site here. Um, and so as the blue line crosses these lines, the system generates the corresponding alerts. So at a glance, you can see, when you're looking at this, you can see both what the water is doing and how that compares to the roadway thresholds our crews care about. So our alerting is fully customizable. Any gauge in our network can send notifications based on what you care about. We can set simple stage thresholds, rate of rise, or require a duration above a certain level to reduce noise. But if you know the location that carries with water at a specific stage, we can build notifications at those levels. And so our delivery is flexible. We can send texts or emails and also tailor the recipients by area or roles. And so these alerts can help your crews or partners keep aware of the changing conditions so they can act early. And so if you are a public safety official and like to get alerts for your locations, you can contact us and we'll set them up for you. So the next slides, I do want to talk about the website that displays all the information from our flood warning system. And on our homepage, you can immediately see that we display live rainfall and streamflow information from our monitoring stations, but also we have quick links to National Weather Service watch and warning products. All right, next slide. And so on our website, there's six main tabs, I would say. And they are listed here, which I will go into a little bit more in the subsequent slides. But just again, these are set up in a way to provide a quick access to areas of interest. All right, next slide. Okay, so on our homepage, we do display information. We have the radar observations, we have a map of the rainfall summaries, and also a quick link to National Weather Service rainfall alerts. All right, next slide. And so the dashboard tab of our page shows real-time information by watershed. And watersheds are bounded areas where water collects and drains out of a common outlet. And so we have dashboards customized for each of these watersheds. And so let's say, for example, you're in northern San Diego County in the San Luis River watershed, or in central San Diego County, San Diego River. We have dashboards that display real-time information in these areas. And so on here, we have a legend that shows the frequency of the rainfall. And it will be color coded, so you won't have to do that math or look it up yourself. Our dashboard will immediately show the intensity of the rain that's falling in that watershed. Right, next slide. Okay, so then the other tab that we have is our map tab, which um, provides a map showing all the locations, all the sensors within our network. And so on here, you can quickly get a visualization of rainfall occurring, stream levels, what some of our weather stations are reporting, but also on this uh, tab, you have the ability to click on a site and look at the historical data for it. And so I find this more useful because you can really track precipitation in real time, especially as it moves across the county. All right, next slide. And so right now, there are some gaps in the data that is displayed on our website. And this is due to recent changes at some of our partnering agencies. But if you do notice some of these gray symbols on our website, these stations are currently offline, but we hope to bring them back online within the next couple of years. All right. And then the final tab is our sites tab. And on here, you can explore all the sites within our network by typing in their names. And then you can get a quick view of all the information each site provides, similar to what you would find on the dashboard in the map tab, but rather on here, you can go directly to the site. All right. So the other thing is if you are interested in getting data from our flood warning system, our website restricts users to download only up to 60 days worth of data. However, if you would like to download data beyond 60 days, we do have a link that's displayed on our website. And from there, you can enter the information that you're looking for, and we'll be able to accommodate that request. Okay, so I do appreciate your time today to learn about our flood warning system. And our system is flexible, so we can pull in a wide variety of hydrologic and meteorological sensors. And so if you have interest in adding a gauge or any sort of weather station in an area, we can you can certainly contact us and we can talk about that potential with you. All right, thank you.
Thank you so much, Tyler, for walking us through your process and also the webpage. That's also in the chat links for all of you to access. We had a question come in, and since we have you here, what changes or improvements would make the biggest difference in helping communities respond more quickly and safely to future flood events?
Yes, so that is a very good question. So I think the biggest difference will come from combining technology with community engagement. So on the tech side, that could look like integrating data from our alert system with radar data or weather forecast models so that we can provide a more accurate warnings. But I also think it's equally important uh, that we maintain good communication. So the alerts need to be fast, multilingual, and also accessible across many platforms. And so I guess the final thing I think would be preparedness. And so uh, that would be getting communities access to the alerts, and so that response times can drop dramatically, but also just better data integration, inclusive communication, and ongoing public education, I think, would really help in this area. Yeah.
Great, thank you, Tyler. And the audience, feel free, as you think during this, the rest of the telebriefing, to submit other questions, and we'll make sure that Tyler answers them, and we'll provide that in our follow-up email after this. Thank you, Tyler.
Thank you.
All right, now this is the time we're going to move on to our panel discussion. And I'm very happy to introduce today's discussion moderator, my co-lead on the Live Well San Diego Rural Communities Work Group, San Diego County Fire Community Emergency Response Team Coordinator, Teresa Greenhall. Teresa has the pleasure of managing the SD CERT program under her direction. The program has grown from one team to one program with 6 teams and 100 volunteers. And now for a brief introduction of our honored panelists before I turn the floor over to Teresa. We have Amy Iltz. She's the Director of Programs at the Jacobs and Cushman San Diego Food Bank, overseeing countywide food access initiatives. She brings over a decade of leadership experience from the USO and academia, specializing in program management, nonprofit operations, and community engagement. Amy holds a master's in public administration from San Francisco State University and a bachelor's in parks and recreation and leisure studies from San Jose State University. Next, we have Nicole Bloomfeld. She's the Vice President of Data and Technology Solutions for 211 San Diego, bringing over 15 years of experience in advancing data analytics and enterprise technology in the social services sector. Grounded in social justice, her approach centers on using data and technology to drive systems change, leveraging data to understand community needs, and ensuring technology platforms effectively serve providers and the people they support. Next, we have Dr. Seema Shah. She serves as the Epidemiologist and Immunization Services Branch Medical Director for the County of San Diego's Health and Human Services Agency. Dr. Shah is a pediatric emergency medicine physician who previously held roles as the medical director of the emergency department at Rady's Children's Hospital of San Diego. She is also a voluntary professor of pediatrics at the University of California, San Diego. And last but not least, we have Cameron Hensley. He is a community health worker with the County of San Diego's Behavioral Health Services Department, dedicated to supporting the well-being of residents through outreach, education, and advocacy. Born and raised in San Diego, he has a deep connection to the community and a passion for making a positive impact. In his free time, he enjoys hiking, visiting local parks, and staying active in vibrant San Diego outdoors. All right, if you have questions for these speakers during the panel discussion, please enter them in the Q&A box right here in the bottom of your screen. And I will pass it over to Teresa now.
Thank you, Liz. So, Cameron, we'll jump in with you first. Could you please tell us about the work that you do? How did you get involved with this work? And it's going to be just a quick 1 or 2 minutes because we've got lots of questions that have come in.
Yes. Hi. Thank you, Teresa. Yeah. Hello, everyone. Cameron Hensley here, community health worker. Yeah. So, what got me into this role is that so I have a bachelor's in public health, and so I've always been passionate about working with the community, just working with people, educating, and just kind of doing promotion and making sure everyone has equal access. And I've been doing this for about, I'd say, 3 or so years.
Thank you. Amy, you're up next. Same questions. Could you tell us about the work that you do and how did you get involved with this work?
Absolutely. I do a lot of the outward facing work with our partners for the food bank. So I oversee our partnerships with over 450 nonprofit partners throughout the entire county and making sure that we get safe, nutritious food out to those in need. And I spent most of my career in nonprofits, originally starting with programs for youth and girls, and I eventually evolved into continued work across the community. Always had a passion for serving others and working in the field.
Thank you so much. And Nicole, you're up next. Again, same questions. Please tell us about the work that you do and how did you get involved?
Yes, hi, good afternoon. My career started, my schooling started with a master's in social work, and I kind of I fell into the data world working in public schools and then moving over to the nonprofit sector. So most of my role, or a big part of my role, is looking at data and information and how we can better understand what our community needs, both from what our clients are telling us and the information we have about their needs, but also about the community resources and where those resources are and perhaps where they are not. And so it's really that intersection of that data that we use really heavily to inform internal programs and to provide that information to the community for more proactive work. And then I also work really heavily with our with our partnerships and making sure our resource database is robust and accurate.
Great, thank you so much. And then lastly, Dr. Shaw, same questions for you. Tell us about the work you do and how did you get involved with this work?
Right. Hi. So for me, I actually have been a practicing pediatric emergency medicine physician in this community for a very long time. I've been here tied to the community for 20 plus years. So I did all my training here. And then did a master's in public health about 5 years ago and at Johns Hopkins and really fell in love with public health and serendipitously found this job. And so have been doing disease control now for 5 years and love it. And it's really managing outbreaks, interfacing with the community, trying to, really be able to help where I can. And so anything from vaccinations to, the respiratory reports that you read, on a daily basis to an outbreak at a restaurant, my hands get to be in all parts of that throughout the county. So it's really kind of an interesting.
Thank you so much. So thank you to all of our panelists today. It's a pleasure to have you sharing with us, sharing important information and your knowledge with our rural residents and rural serving organizations. So we have time for a few questions that were submitted by attendees. I saw one from, it looked like Paul Stein. Did you see that? It is, at what point, this is for Tyler, if you're still there, at what point are evacuation orders given?
So,
do you know?
Yeah, so we do not generate evacuation orders from our system. And for floods, the county doesn't, at least in the unincorporated county, we don't generally issue evacuations for flooding. And those would come from our Office of Emergency Services should they occur.
Right. Thank you so much. Okay, we will jump right in. Dr. Shaw, talking about flooding. What health risks should communities be aware of related to chemical spills, contaminated water, and mold growth. And what steps can residents take to protect themselves during cleanup and recovery?
Well, there's a lot in that. So, especially during an acute flooding event, one of the things, there's a lot of things that can happen. People often think, well, it's just rain. It's not really anything that should be water, it's just plain water, right? But it's actually not. It's often, there's a mixture of animal and human waste potentially. There can be chemical spills. There can be hazardous waste, and even the household cleaners that you don't think about, that all could be mixed in there. And then oftentimes, so of course, like during a flooding event, making sure that, looking at your surroundings, rinsing off after the event, if you've been actually actively in the floodwaters, if you have open sores, making sure that those are, actively covered up afterwards. And then after the event, when you're doing the cleanup piece of it, it's really, again, there's a lot of environmental resources that you can look at. But it's making sure that there's no mold, and while externally it may not be so obvious, but there may be some that may have built up behind your molding at the base of your baseboards, or even into your walls. So some of that actually may be present. So lots of different things that can happen as a result of from those from the actual active flood event. And let me
Thank you.
know,
Yeah,
Teresa,
that was a lot. That was a packed question. Thank you so much. So Amy, this is one for you. How are you collaborating with rural schools, libraries, tribal communities, community centers, or local nonprofits to expand awareness of food resources and support service delivery?
Yeah, great question. We do partner with some locations out in rural and remote areas. We do partner with tribal communities to hold actual distributions. So knowing that there aren't a ton of resources, we utilize our mobile pantry program for a lot of those locations. So our refrigerated truck goes out, distributes food, stays on site. Our other model is to work through partners that are already established within the community. So we work with everyone from your small church pantries to your Salvation Armies, your Brother Benno's, your Father Joe's. And so that way we know we're partnering with folks who are very much connected within those communities so that they can use their network and their expertise to be able to get that information out. We also partner with 211 to make sure that our food distribution sites are publicly listed. And so folks can call in with their zip code, either where they live or where they work or wherever's convenient for them, and find the closest locations. That way we can ensure that it's getting out as much as possible. Always happy to answer phones here at the food bank as well for anyone who calls.
Thank you. And thanks for the segue to Nicole. And Nicole, many rural community residents have inconsistent access to internet or cell service. How does your organization ensure that critical information about resources reaches people who may rely on in-person, phone-based, or community-based communication rather than online platforms?
Yeah, I mean, I think it's a couple. It's a couple of things that we try to do. One is always partnering with the local organizations. When we're referring to clients out to different programs, understanding whether or not they do have any preferences or needs to be in person or not, or a phone-based service versus more virtual. And so we'll refer people there to those resources when we are able. We do also provide text messages and emails. So this way, even if service is intermittent, they can refer back to that information and can always access the database online. So again, even if it is intermittent or only able to get access to the internet in certain places, that information can always be looked up at a later point in time.
Great, thank you so much. I didn't know that texting was an option. So that's great. And Cameron, here's a question for you. What services is your department able to provide residents following a disaster such as flooding?
Yeah, that's a great question. So what we try to do after a natural disaster, whether it's an earthquake, flood, anything like that, we try to focus on like four main things. It's like emotional support, connection to care, and stabilization, and even emotional support. So these are kind of the things that we like to keep in mind after a natural disaster. And being born and raised in San Diego, there's a lot of earthquakes, rarely any floods. But so what we try to do is like we have like crisis counseling, psychological first aid. So anyone, individuals, family members that have lost someone, have any trauma, or leaving displaced from their homes because of the flooding. So we try to do that as well. We also have like mental health and substance use support. This includes like short-term counseling, referrals or ongoing treatment if needed, stuff like that. There's even like support for vulnerable populations, such as like senior citizens, like at-risk populations, like refugees and people like that, or with individuals with serious mental illness. We also do like resource navigation, so we can help residents with like housing, food, medical care, and even we have the resources that I'll dive into later. But yeah, so those are some of the ways that we try to help people with after the floods. Yeah.
Thank you.
Mhm.
And any kind of disaster is pretty stressful,
Mhm.
right? And if you went through the
Mhm.
floods in 2024, any new heavy rain is going to trigger
Yeah.
that. So it's great that you guys have those resources.
Mhm.
Dr. Shaw, this one goes to you. During an evacuation, normally residents would go to an evacuation shelter if they had no other family in town or means to pay for a hotel. What recommendations do you have for residents if they are ordered to evacuate due to a disaster, but have symptoms of flu, COVID, RSV, or any other possible contagious disease?
Yeah, I mean, I think times have evolved, and I certainly think that for the safety really of others, the best thing to do if you're going to be in a congregate setting is to simply wear a mask, and I think unfortunately, when there is no other alternate option for housing, I think that's the safest thing to protect others from getting sick, because there's likely chance that there could be someone else there that's immunocompromised or have other complex medical problems. So you really don't want to put someone else at risk. So really a great idea to just put that mask on if you're worried, especially, for example, right now where there's lots and lots of flu circulating. You really just want to be able to stay safe.
Thank you. And I would imagine it would be prudent for them to notify the team when they're checking in and registering to stay at the shelter so that they could, if they need to, set up kind of an isolated area, especially for those that are have compromised immune systems.
Yes, absolutely.
Thank you. So, Amy, this one's for you. During emergencies such as severe weather, wildfire, public safety power shutoffs, what is your organization's approach to maintaining continuity of food support for rural families who may already experience limited access?
We work pretty closely with SDG&E, especially around the power safety shutoffs. So we understand when those are approaching. For emergencies, we don't have quite the notice. But we work to put a system in place so that if we're approaching the mark when people are going to be without power, may lose food, even if they do have access to food, we increase the supply of food available at our existing partners. So we work with folks from Valley Center out to Campo and Boulevard, Alpine. We've got folks that provide ongoing food support. But during those times of emergency, we reach out to those partners and see what kind of capacity they have to take an increase so that folks that may already be familiar with the systems that are currently in place already know where to go. They understand who those folks are, where those locations are, so that they can access that food, even if they're normally food secure and they don't have too much of an issue, but because of power shutoffs or lack of access, if the roads are flooded, they can continue to go to those very trusted partners within their own community.
Perfect. Thank you so much. Liz, do we have time for a couple more questions? Just double checking the time.
Yes, we do.
Okay, perfect. Thank you. I thought so. I just didn't want to go over. And let's see, Nicole, your organization provides resources before, during, and after a disaster, which is great. Briefly describe the types of resources residents can access from 211 San Diego.
Yeah, so we have a couple different partnerships, both with the county's Office of Emergency Services and also with San Diego Gas and Electric during PSPS events. And I'd say we provide resources for before a disaster, during a disaster, and post. So during a disaster, for especially for like a declared emergency, we are the partnership that we have with OES really started as a way to help offload some of the calls to the 911 system, and for folks for non-emergency but urgent questions about evacuation orders and road closures, they can call 211 and get real-time information. So I think that type of information is typically, like road closures or if there's a shelter, emergency resources, where folks can take their animals. That information we have real time during a declared event. And then in the space kind of in the either the pre or the post, or especially for some of the more maybe the weather-based incidents that we've had more recently, access to food resources, just like Amy mentioned, we're providing referrals out to our food pantry partners. If there's any emergency CalFresh benefits or disaster replacement benefits, we'll often refer there as well. But for the most part, it's it's in the event itself, it's real-time information. And then post-event, we can connect folks either to city or county resources for debris removal, or for any, if there's additional financial resources or local assistance recovery centers will often have that information, so folks can go to those physical places and get more information. Like if it was like getting your like physical papers. I'm drawing a blank on the documents, but certain legal documents you could get replaced at those events as well, or some examples.
Thank you. And here's a follow-up to that. So if there's a large-scale disaster with many residents needing access to resources, which we've seen in the past, is 211 able to scale up their service to prevent time-sensitive delays or adding more stress to somebody because they're trying to get a hold of you and they can't? So
yes. And so we have both the ability to ramp up with our staff, but we also stand up and provide and have support either through the county or often through our volunteer network. But our technology and our people power can ramp up pretty quickly and be able to take a significant amount of calls pretty quickly. And we are, again, that partnership is with a lot of our partners, and kind of letting folks know, if there's a big massive event, some of our operations will be on hold so that we can ensure that we're getting the most, the urgent and critical needs out in that time.
Thank you so much. So Cameron, this is for you. Being in the rural community, transportation, long travel distances, and limited broadband internet are major barriers for our rural families, me included. What does your department take to reduce these access challenges and make it easier for residents to receive services?
Right. No, that's a great question. And again, I really like this because I've grown up in East County and working in East County for the last 3 years. There's a lot of working, especially in Mountain Empire region and Campo. There are a lot of families that don't have access to drive into town and to drive like an hour, into the city. So what we try to do is like provide like telehealth and like phone-based services, which is like our access and crisis line 988, like our suicide hotline. That's over the phone and talking to like a behavioral health clinician on the other end. We even have like mobile community-based services. So we have like mobile response teams that can go out to schools, clinics, anything like that, just so they can get the proper care if they're having like an emotional breakdown, they're in a crisis, whether it's opioid overdose, having like a mental breakdown, anything like that. So we try to meet them halfway or try to go to them as much as we can based on their mobile services, like the availability, their locations, all that kind of stuff. And we even try to like partner with like local providers, agencies, especially like I mentioned, like San Ysidro Health has a clinic out there in Campo, places like that. So we try to really work with people that are boots on the ground that are there already, so we can kind of help with that. Yeah.
Thank you. So Dr. Shaw, you answered this a little bit, but it was another question that came up. So what health issues are associated with local weather disasters? We talked a lot about the flooding, but we also have the extreme heat where we're at. We've got the fires, we've got the wildfire smoke. So what health issues do we need to be looking for or be concerned about with those?
Well, how much time do we have? But I mean, so there's a lot. So, and each one kind of carries its own specific level of concern, right? So with heat events, obviously a lot of the heat related illnesses, so excess perspiration leading to dehydration, to even extreme like stroke-like events. So there's that piece. With wildfires, there's concern, and even flooding, right? So with flooding and mold related situations, you can have asthma and allergic type situations, right? So you can have an excess of events. Now, those are two different things, right? With wildfire, there's an air, and with particulate in the air, you can certainly have a lot more in an acute situation with asthma. And then with flooding, that's a delayed thing. You'll see that much later, and it can be really slow in onset, right? And then with flooding, sometimes I mentioned that you can have there's human waste, there's animal waste. Sometimes there can actually be viruses and bacteria that are transmitted. So sometimes you can have gastrointestinal illnesses that come through with that. So be vomiting and diarrhea that shows up. So just really a lot of different, it just really depends on what kind of environmental event is occurring, but there are lots of different illnesses associated with each specific one.
Thank you. Let's see, Amy. Keeping in mind, many rural communities have limited internet and cell phone service. We talked about this already, but how would residents with that limited access, and maybe they're not aware of you guys in the first place, how would they find temporary food distribution sites following a disaster?
Yeah, so that goes back to our partnership with both the county and folks like SCG&E. When they set up temporary assistance locations, we're in contact with them. So when folks know that they can go and receive some of those services around an emergency at, typically they're in libraries and local organizations, they're all aware of food bank services. So if we are not physically at that site where they're providing those services, we have already communicated with them where additional sites are in those communities so that they can get that information. So showing up in person, they'll be able to get that information just the same as they would be able to over the internet.
And I would think that for those that are, living off the grid, maybe their neighbors need to help them with that information and say, hey, this is where things are happening. So it's those neighbors helping neighbors, I think, also are getting that messaging out, right? So we rely on all of you partners and community residents listening in on these telebriefings to help get those messages out. So I appreciate that. Let's see, Nicole. For limited English proficient residents, how do they access resources in their native language via your website or telephone?
Yeah, so we have a partnership with the translation service, and so we can take calls for over two languages. So any language, and folks speaking any language can call 211, and we're able to provide that kind of still that real-time assistance in folks' native language. And then most of our agents are also bilingual Spanish speakers. So we do have and there's a couple other folks that speak other languages as well. But we for sure have the ability for any of the callers that call 211.
Great, thank you. I wasn't sure how that worked because I knew that you could, have a group for 200 languages, but I'm like, how does that work? So now we know. Thank you. Cameron, looking ahead, what opportunities do you see for cross-sector collaboration with county departments, rural agencies, or community partners, like we have on our telebriefing, to improve food access and resource navigation for rural residents?
Yeah, that's a great question. So to start off with, again, like you mentioned, trying to partner with different county departments, like food banks, like San Diego Food Bank, a Hunger Association, all those great organizations. So we try to do as much as we can with them, just to kind of connect and see what we can provide our resources there, to have that connection. Another way is like community health workers like myself, navigators, like we can just connect with residents, whether it's out in an event. Sometimes I go with the Mountain Empire, like the high school. So I can be like the first line of defense, so to speak, to provide this information, and to even connect with another department here with the county. Another one would be like just joint outreach and education efforts that just build trust and awareness in the rural communities. And I know it's tough it's really tough to be out there and kind of living off the land, so to speak. And so it's really important for myself and for at BHS to kind of partner and see what we can bring to the table. So.
Thank you. Dr. Shaw, here's one. It's a little bit different than probably what was in the Q&A section or that we got, only because some of the other questions you kind of answered. But so digging deeper into the effects of flooding or a disaster, I'm looking at more, not the physical, because we talked a lot about that, but more what should I be looking for in myself as emotional or mental, where I need to maybe reach out to Cameron's department and say, hey, I need some help processing this. And so do you have any ideas, suggestions on maybe threshold points we should be looking at?
Yeah, I mean, I think that that's a great point, and I think Cameron kind of already alluded to this, but I think that it is very well documented that people in these stressful situations have even long-term impacts. So this isn't just something that happens and it's an acute thing. You know, we hear about PTSD related to flooding events, especially again, not an unusual thing that we've heard about. And so, yes, I mean, I think that there are absolutely resources that, even for example, through 211, I think is a great triage point for being able to refer people to our county behavioral health and our actual, actually, why am I having a number blank right now? Anyway, so and actually, Cameron, you probably know it offhand. Why am I suddenly? This is like not enough coffee today, clearly.
98, is that what you're looking for?
Yes,
The
thank
number?
you. Yes, thank you. Yes. So that's another perfect resource, and actually, and one that we often will give out that, again, if you're starting to feel like that, you don't have to be there, right? I think that the problem with that people feel like, oh, I have to be feeling all of these things in order to seek help, but don't get to that place. It doesn't have to be the most horrible reasons to be able to be feeling that in order to seek care, because these are very traumatic events. It has huge impacts on your life. You see your home, that's a disaster. You see things that you love that may be in shambles. So I think that these are reasons enough to be able to seek care, and I think that that is completely appropriate. So yes, this is a very well documented and very important thing that, yes, I maybe not have the physical pieces, to your point, Teresa, but what's happening internally may be even of greater consequence.
Thank you so much. I think it is time to start moving on to Liz, because we're winding down the time. Thank you guys so very much.
Thank you to all our guest panelists and our moderator. We have all of this recorded as well. We understand that there are some Wi-Fi and scheduling barriers for a lot of the rural organizations and residents to access this. So we always record it and we send it out in a follow-up email. All of the questions and answers will also be sent out in a follow-up email from today. So on your screen, we will pull up again and put in the chat ways to stay connected with us. We'll send out those materials in the coming week. We really enjoyed this time together with all of you. Thank you again for joining us, and we'll see you soon.